Okay, before going to the development of the tongue, we should be knowing that how embryo looks like. You can see this is the head end, and you observe that this region should be the neck area, future neck area, and we can see the curve of the body, right? Here we know that in the region of the neck, some special apparatus has to be developed called as pharyngeal apparatus. And on the outer side, we can observe various arches. So these are pharyngeal arches. This is arch number one. This is second arch. This is third. This is fourth. Fifth never forms. Rather, we have got sixth pharyngeal arch as well. Why we are learning this? Because these arches and of course the pharyngeal apparatus will take part in the formation of the tongue. Now when we cut the pharyngeal apparatus, now we are looking from within outwards. This is the region which is covered by the endoderm, and the area on the outer aspect is the ectoderm, and the intermediate area on both sides in the middle is made up of the mesoderm. Here you can see various pharyngeal arches. These are the arches number 1 on both sides. This is the second pharyngeal arch. This is the third pharyngeal arch. And this is the fourth one. Fifth never forms, and there lies the sixth pharyngeal arch. Now concentrate how the tongue develops. So see, first of all, the first indication of the tongue to be formed is via a protuberance in the middle called as tuberculum impar. This is a single structure, hence called impar. Now you can see two lateral swellings called as lateral lingual swellings, and you can well see that they are originated from the first pharyngeal arches on both sides. Okay, now see the next thing which is prominent. We can see the small orifice. This is the foramen caecum. Just behind that, we can have another median swelling called as cupula, or the hypobranchial or hypopharyngeal eminence. Just caudal to it, we have got the epiglottal swelling, and you can see there lies the laryngeal orifice, which is being covered on both sides or flanked by the arytenoidal swellings. Okay. Now, in the next picture, you can well see that now these two lateral swellings, they overgrow more than that of this tuberculum impar, and finally they form the anterior two-third or body of the tongue. As we can see that there is a demarcation being separated. The anterior two-third of the tongue is separated from the posterior one-third by a V-shaped sulcus called as sulcus terminalis. Now see here that the next median swelling called as cupula or hypobranchial eminence, it is being originated from the second pharyngeal arch, the third pharyngeal arch, and partly from the fourth pharyngeal arch, right? Okay, just below it, the epiglottal swelling is formed from the fourth pharyngeal arch, right? Now we have to focus that how this tongue is completely formed. First arch gave rise to the body of the tongue. The second, third, and part of fourth gave rise to the posterior one third of the tongue. Now the most posterior part of the tongue is contributed through the fourth pharyngeal arch. Now, with the help of these arches, it is easy to learn about the innervation of the tongue along with its embryological basis. So, as we can see that the first arch gave rise to anterior two-third of the tongue. So here, the lingual branch of trigeminal nerve or fifth cranial nerve is going to supply the body of the tongue. Whole of its mucosa is being supplied by it. So, general sensory innervation is via fifth cranial nerve. So, what about the special sensory innervation? That is through the chorda tympani branch of the facial nerve, which is seventh cranial nerve. Now you can see that the posterior one-third part, which is formed by the contribution of second, third, and fourth. Here, what happens? The third arch dominates and overgrows to that of the second arch. So, the nerve supply here is via glossopharyngeal, which gives the general sensory and the special sensory innervation to the posterior one-third of the tongue. Now, what is left? The most posterior part of the tongue, that is being supplied by the vagus nerve through superior laryngeal nerve, and of course the recurrent laryngeal nerve would be also there. Now we will learn another thing regarding its musculature. Okay, now in this picture again you are focusing on this pharyngeal apparatus and arches, and you can well observe that the occipital myotomes will migrate towards these arches and they will give rise to the musculature of the tongue, either extrinsic muscles or intrinsic muscle. So, the nerve that travels along with these occipital myotomes to supply this muscle is the 12th cranial nerve, except a muscle called as palatoglossus, which is supplied by the pharyngeal plexus formed by the contribution of vagus nerve. Thank you.